Hey guys, welcome back to the Best Practice Show. My name is Kirk Behrendt and I'm your host. Today, we are going to have a blast. And one of the heroes from the COVID conference, we've got him back for a special treat today. And we're going to be talking about the edentulous patient and the dilemma and some possible solutions, even talk about materials a little bit. So you are going to absolutely love this. Now, I always like to welcome people. If you're joining us for the first time, which over 38,000 of you joined during the COVID conference. We didn't even know what we were doing, but a lot of younger dentists got involved, dental students, and even dentists fresh into practice. So if you're finding your way to the podcast for the first time, I just want to do a couple things. Number one, I want to welcome you to a community where there's no egos here. We're just all here to learn. And I want you to do me a favor. If you're listening on your phone, like if you're working out and you're running on the treadmill right now, or wherever you're listening to this podcast, whether it be on Spotify or Stitcher, do me a favor, go down to the subscribe button and just hit the subscribe button, because you're going to see every single week, I'm going to bring you a brand new expert in dentistry to bring you some tips to make your practice better so you could have a better practice and a better life. And I don't want you to miss out on it. Number two, if you haven't joined our private Facebook group, make sure you join us over there. It's called The Best Practices, powered by Act Dental, where it's grown to over 13,000 people. And it's just a great community where if you show up and ask questions, you're going to see there's a lot of people there that are willing to help. And then also, if you haven't shown up or joined us over at actdental.com, you're going to see we've got a great selection of master classes for some of the best names in dentistry at Act Dental U. Or if you just need help with your practice, show up over there. And we're always here to help. I had some great conversations, even with young dentists today. They're like, I don't know what to do. We love this stuff so much. And the coolest thing about dentistry is you can do it however you want to do it. You get one shot at this thing called life. There's no one way to do it. You just got to find the best way for you. And so join us if you've got some questions over there. And I want to introduce my guest today because, Pat, I've known you for a long time. And I feel a little separated from you, actually a lot separated from you, because I lived in Kansas City for 15 years. I got to know you. You also are hanging around with my great dental friends there. You have your own study club there, and you've been a speaker for a long time. Some of the people that are listening got to know you even better through the COVID conference. But today we're going to be talking about the edentulous dilemma and some of the solutions that you see in your practice. But I want people to know who you are. If people are listening today, or if somebody's listening today and they don't know who Dr. Pat Lillis is, give us a little insight. Who are you, brother? Where do you practice?
Hey, thanks, Kirk, for having me. It's truly an honor to be on your show. And so thanks for having me again, brother. We miss you here in Kansas City, but we're glad that you're in Milwaukee, and I make, like we were talking about earlier in the show, I make it up there a couple times a year, so I'll definitely hit you up when we go. But my name is Pat Lillis. I practice in Overland Park, Kansas, which is directly probably in the middle of the entire country, I would probably say. I grew up in Des Moines, Iowa, home of our mutual friend, Bob Margis, who we've known Bob for a long time. And then I did my undergraduate work up in Marquette, up into your stomping grounds, Kirk, for 4 years. And then I headed over to Creighton for dental school, home of our other mutual friend, Aaron Elliott. I was a year ahead of Aaron in dental school. Awesome. And then came down to Kansas City and did a 2-year AGD program here. So I spent 2 years here in the Advanced Education General Dentistry program. Incredible mentors, friends that still are my friends today. And then I got out of residency and I got a chance to work with Dr. Bernie Williams, and I took over his practice in Overland Park. And some of you know Bernie, some of you don't, but he was kind of a TMJ, TMD guru, occlusion guy. And he really, truly was one of the best dentists that I've ever known. So it's a real privilege to have worked with him and then eventually taken over the practice. And so Bernie retired. We worked together for 2 or 3 years, and then he retired, and I've been here ever since, just kind of holding down the fort.
Yeah. Well, and I'm just going to say this. I'll say this a couple of times. If you guys are looking for a great speaker to your study club, I mean, and if you haven't had Pat, you got to have Pat, because Pat's a real guy with awesome solutions. He'll test the way you think, and you got to check it out. We'll be talking about a little bit more about that as we get later into the podcast. But Pat, let's talk about the edentulous dilemma. You know, we're going to talk, that's a mouthful. Now, I want to keep my teeth forever. Some people don't. And this is a challenge for a lot of dentists to go down this path. Let's talk about the why before the how. I always like to start with that. This is a big thing for restorative dentists. And we're going to be talking about the dilemma and how we solve it. But why is it so important for a young dentist listening today?
Because it's becoming a bigger and bigger issue. I mean, flat out, when I started practicing, I would see some of these patients just kind of trickle in through the door. And then, gosh, over time, it's just becoming so rampant. And you kind of scratch your head thinking, well, why are so many people losing their teeth, and, demographics of patients, et cetera. But I don't know. It's just that it's just more and more. It seems like every week we get more and more of these patients that come in through the door. And I think it's becoming time that, as a young dentist, I mean, if these patients are coming into my practice, then they're definitely coming into your practice. And so if you don't have the tools in the tool belt, so to speak, then it's going to be very, very difficult to treat these patients. And I just think it's something that we have got to learn how to do, whether you like it or not. So.
Absolutely. And if you're younger dentists listening, you already know this. One of the biggest challenges the United States has is not the healthcare and economy. Those are big challenges. Don't get me wrong. It's the aging population. Right now in Japan, adult diapers are outselling children's diapers. Now, let me explain what that means for you as a dentist. 1 in 3 babies born today is actually going to live to be 100. So you might be thinking to yourself, oh, I'm only working on patients that are in their 30s or 40s or even 50s. The truth of it is that younger dentists now are going to be working on patients that are in their 80s, 90s. And I don't care how good you are, things fail at some point at some level. Even the best restorative dentists know, look, I'm going to do something for you, Mrs. Patient. I'm going to create something, but it all fails at some point. Marco Brindas is like this. Everything fails. You know what I mean? Like, we just don't know when. So I think it's true. I mean, Pat, the aging population is going to be a significant percentage of everyone's practice in the future. And we got to be ready with solutions, right?
100%. I mean, these are things that we have got to offer these people because they're really searching for it. And the rewarding thing is that what other option do they have? I mean, they're really forced with no other option. And so, again, they're looking to us for our expertise, and it's kind of our duty, so to speak, to be able to help these people out.
Yeah. So help me out. If I'm a 32-year-old dentist and I'm like, Pat, I got my hands in I'm just trying to do single crowns back here. I'm heavy in insurance. Help me see the future in this. Cause you're going to be talking about some of the complex things, but we're also going to be talking about materials. Where do I start? Maybe we should probably start with a good definition of what this is, and then how do we look at it as far as helping patients?
Yeah, I think that's a really good question, Kirk. And there's so much education out there on this topic. My gosh, if you were to Google all on four, I'm sure tomorrow you could find a course in your area on how to do it. So I think the first thing you need to do is just kind of like anything else, you need to get educated. And that's where I would start, because it's no different. I like you mentioned before, I do a lot of lecturing and feel very blessed to be able to do that. And when I'm giving courses, people always come up to me and they say, Pat, I really want to do these courses. I mean, I want to do this treatment. Where do I start? And I said, well, you got to start with a course. So there's lots of courses out there that can do it. When we were lecturing, we were kind of going through the steps on how to do it with different dentists as well. But that's the first thing you got to do, is you got to go to educated. No different than, Kirk, like say you were trying to take on full mouth rehabs on teeth cases and changing vertical dimension and all this kind of crazy dentistry. I think it's kind of the same thing. You have to kind of get educated first before you can do it. And I would say that would be the very first thing I would do, is just get educated. And then after you find a course or you get educated, then it's time for implementation. And that's kind of like where you guys come into play, right? I mean, how many times have you talked to young dentists and they get all charged up to do this treatment, and then they kind of come home and they don't know how to implement it in their practice? Because once you get educated and you want to do this type of treatment, then you got to implement it. And that's kind of where I think that's where you guys, Kirk, can really help these younger dentists get this find it a way to fit into their practice, because it does take a bit of time, and it's different than doing regular dentistry.
Yeah, for sure. For sure. And, it's funny you say that because team members now are getting good at distracting the dentist when they come back from spear or panky or whatever. Like, let's keep him super busy so he doesn't come up for air for another week. Completely forgot he even went there. Type of thing. I get it. There's a lot of challenges coming at dentists. Now, the other thing you said, education for dentists, but I mean, Pat, you see this probably. And I even had an aunt ask me, like, what's an all-in-4? And patients are doing their own education, and they're getting their education from like YouTube and other things. So we've got to be equipped when they come in and start asking questions like this. Do I do all-on-4? What is it? All that kind of stuff. And then all-on-4s with plastic teeth. I mean, tell us that, as far as that perspective goes.
Yeah. And I'm glad you brought that up, because this is the number one thing I see is that once we get onto this all-on-4 train, which is good to get on because it's an incredible solution for these folks, but then we have got to offer them zirconia or some sort of ceramic type procedure, because that is something that is a completely different animal than plastic teeth. And, very on in my career, the options were a little bit limited in the porcelain world, but gosh, nowadays with all the materials that we have with the zirconias, with all the bars and all this really amazing technology, we can do zirconia, we can do ceramics very, very routinely. And it's a thinner restoration. It's smaller. It's more challenging to do it clinically, but it's an amazing thing. And I see that getting left out of treatment plans. And the reason I say that is because on several occasions, people will come into our office for a second opinion or this, that, or whatever, and we'll give them the same, but then we give them the zirconia option. And I can't tell you how many patients have elected to do that type of procedure simply because they view it, the plastic teeth, so to speak, acrylic teeth, as kind of like, well, that's just kind of a glorified denture. And we all know that it isn't, but they want to do something a little bit better. And I tell them, this is about as sophisticated as we can get in dentistry in this office, is to give you a full arch or zirconia on implants. It's kind of the closest thing I can give you back to your natural teeth. So that's something that is important that we discuss with them, at least give them the option to do that. Yeah. And so understanding the materials is really, really, really important when we're doing these cases.
Yeah. And can you ever remember a time where the materials are getting so much better in so little time? I mean, the zirconia alone, the definition of that and the materials and in such a short period of time, you and I also share another mutual friend other than Bob, it's Bill Robbins, who says there's never been a better time to be a dentist with the advancements that we have in these materials, especially zirconia. Like, I can only imagine what it's going to be like in 3, 4, 5 years.
Oh, Kirk, are you kidding me? When zirconia, I'm old enough now, right, to know the difference between all these materials. And I can tell when zirconia first came out, it was horrible, right? I mean, we never used it because it was like bright white. It was horrendously unaesthetic. But as time has marched on, it's just gotten better and better and better and better. And so, yeah, keeping up with the material science it's become like a job now, so to speak. But yeah, I agree with Bill. It's never been a better time to practice dentistry than right now. We have so many things at our disposal to really help for these patients, to give them solutions that they never had before. I mean, think of it this way, Kirk. If you were to lose your teeth, let's say 30, 40 years ago, what were your options?
Not a lot.
Wearing dentures, right? I mean, that was just kind of the way it was. Right. But now 2021, what's your options? I mean, you can have teeth that are fixed in your mouth. I mean, you don't have to wear a denture anymore. Could you imagine wearing a denture? I wouldn't want to wear a denture. I mean, so it's an incredibly rewarding thing to tell these patients, like, listen, you don't have to if you don't want to. And if you want to, that's fine, but you don't have to. You have these other options. So, I mean, this is emotional. I always tell my staff, this is emotional dentistry, right? I mean, this is changing people's lives essentially.
Yeah, absolutely. And so as we look at the educational market in dentistry, obviously there's a lot of talk on the digital dentistry and aesthetics. I want to see from your perspective, when we talk about Edentulous, let's talk digital versus analog, and the other thing too, everybody loves digital, but there's very few people that have gone the digital workflow completely. It's early in its development, but there's so much possibility in there. Talk about the digital workflow with the edentulous patient.
Can I tell you a funny story real quick?
Please.
On my digital story?
Yeah.
So I'm giving a lecture in La Crosse, Wisconsin, up by your neck of the woods, right? Just west of you.
Right.
And I go to set my laptop up. And of course I put it on the bar because it's in the old style brewery, or is the bar at the end of the brewery tour, right? You know, so they had the bar there.
Yeah.
So of course we're having a lecture in the bar. So I put my laptop and give a lecture. So anyway, so we get kind of going through the lecture, and these guys raise their hands and they say, "Hey, Dr. Lillis, when are you going to discuss intraoral digital impressions?" And I said, "I'm not going to discuss it because that's not the topic today. We're talking about other things, blah, blah, blah." These 4 to 5 guys, and they're all younger, all got up and walked out of the room. Didn't even wait till the break to leave. They just got up and walked out, right? And I was like, this is Wisconsin. This is supposed to be one of the nicest places on the planet, right? But I got back on the airplane and I called my 3M rep and I said, let's do it. I got to start scanning. So I got into digital for all the wrong reasons. I wanted to be relevant on the lecture circuit.
You were bullied into, and I think I know those guys, so don't worry about that.
So I was like, gosh, we couldn't have waited till the break to leave, you know. But anyways, so I started digital, and those were just scanning single to 2 teeth crowns. That's where we started, right? So we started with some powder. We started single 2 teeth crowns. I called the engineers at 3M and I said, I want to like cross the arch. Can I cross the arch? And they were like, I don't know. Try it. So we tried it, and we started then doing, and we cross compared it with some stone models, and we were running some pilot studies and everything. So long story short, that's my digital journey. So I kind of started off back in the days when we were just scanning 1 to 2 crowns. And now, my gosh, are you kidding me? We can scan full arches. We can cross the arch. We can store the scans in the computer. It's just all the planning. My goodness, the planning has gotten out of control. I mean, we're doing wax ups with my technicians. We do them all on the computer together. We never did that, right? We always did it by hand. So the digital aspect now is just mind boggling. So nowadays you can meet with your surgeon before you're doing the cases, and they can merge CBCT scans and intraoral scans. And you can start digitally planning these cases out with your surgeons, and you can get down to bone quality, how much bone to take away, where exactly the implants are going to go before you place them, how many you're going to place, where they're going to go, what's the prosthesis going to be. Those are all things that you can do now in the digital world. But the diagnosis and treatment planning stage, Kirk, that hasn't changed. How we capture and how we plan has changed. But the rules are still there. We still have to figure out, what materials are we using? So that gives the surgeon how much bone to take away, right? That's really important, because if you're going to do plastic teeth, you're going to need more bone reduction, because you got to make room for a bar, acrylic, and some teeth. If you're doing zirconia, you don't have to take as much bone away. So that's where you have to iron that out with the patient before you even start doing these cases. So then once that's done, then you can go to the surgeon. You can say, okay, let's start planning this out. And so you can go to the computer. And that's how we do it here, is we just go to the computer. I sit down with my surgeon. We'd see how many implants we're taking out, how much bone we're going to reduce, because we know exactly what materials we're using. And then on into temporization, and then into final treatment.
Yeah. Now, you do a lot of speaking. You also get involved with other dentists. What do dentists get wrong when they think about going down this path of edentulous patient? Or what's the biggest misconception they have about this path?
They get the biggest. So unfortunately, sometimes we're on the other side of things where we have to fix these cases. And for example, I had a case in this year where they had 4 implants put in the mandible, beautifully done implants, but the patient was told they were going to get fixed, like the teeth were going to fixate onto the implants, but not enough bone was reduced. So then they switched gears and they made it an overdenture. The patient got upset, kind of came, saw us, and it's like, we're going to rescue the case. And I said, listen, I don't have enough room. So we're going to have to take these implants out, then do the proper reduction, and then put the implants in. So the number one thing I see that goes wrong is material selection. What are you doing? Are you doing plastic teeth or doing zirconia teeth? And then how much bone you have to reduce to do that procedure. So that's the very first thing that I see that goes south on these cases, is just that. Number 2 is Are you doing dual jaw implants? Are they for sure taking the teeth out on the upper and the lower? Because that's important to know too. And I tell most people that come in the office, they say, listen, you got a dental budget, right? Everybody's got a dental budget in their mind. I say, listen, put it into the lower arch first. So if you got dollars to spend, do the lower arch first. And then if you have some money spilled over, then we can do the upper arch second. Even then, if you decide that you want to do the upper arch down the road, you certainly can do it, because the majority of people can get along okay with an upper denture for a while. You got a hard palate, you got suction, so they can usually kind of do fine with that. And then you can stage treatment out that way too, because not everybody's got 40, 50 grand to blow on dentistry. Sometimes they do, and maybe they want to do it over time.
Right.
So that's the very first thing I see that goes wrong.
Yeah. The other thing too, because you do this all the time and you are a gifted communicator, but if I'm a young dentist, help me with this, Pat. Like, so I'm going to go back to what you said. My patients don't have any money though. Or this one, have you heard this one recently? Yeah, but Dr. Lillis, I'm not going to live that long. I don't know if I want to make that kind of an investment. Like, help me through the challenge, because you get these questions all the time, right?
As of yesterday.
Okay.
I mean, it's only Tuesday when we're recording this. So yesterday was Monday. So it had happened yesterday. I tell patients, I just tell them the same thing. Margis and I talk about this all the time. I say, listen, you're not going to die because you didn't get this type of work done. So there's no pressure for starters to do dentistry. Kirk, when you do that, it's amazing what happens to case acceptance. When you act like there's no pressure to do this stuff, they'll do it. So, you just tell them, like, listen, I'm just, like we always used to say, right? I'm just a referee. I just call them as I see them. I'm going to be brutally honest with you. I'm going to tell you the truth. I may tell you some things that you don't want to hear, but you're not going to die because you didn't get this done. But the biggest thing you can do is say, here, listen, this is the consequences if you don't do this treatment. You're not going to chew your food correctly. So if you can't chew your food correctly, how are you going to digest it? I mean, I think sometimes we gloss just over just that one little thing right there. Right. Is that if you can't chew your food correctly, then what's your quality of life going to be? So yeah, you're not going to die because you get the work done, but your quality of life is going to suffer. So that's number one. Number two is I tell them, I say, listen, the age portion, because I hear that all the time. I'm 85. I say, listen, we did implants on a 96-year-old patient one time, and she lived till she was 105. She got 9 years out of that treatment. So, I mean, age is never a contraindication of treatment unless if they have all their faculties with them, if they really are healthy individuals and they know exactly what's going on and they want to do that type of dentistry. I think it's our duty to at least give them the option. So when they say, I'm too old to do it, I said, well, what do you want the last years of your life to do? You want to eat? Do you want to chew what you want to eat what you want to? I mean, it's up to you. And I mean, I had one lady say, well, I can't get a car, I can't get a car if I do this treatment. I said, listen, you're going to drive to your restaurant. You're not going to be able to eat. So what difference does it make?
Oh, it's so true when you say quality of life. My mom is 20 years older than me, so she's 70. And when she breaks a tooth, it's the end of she is panicking because every time I'm with her, she's making breakfast talking about what? Lunch. And then when we're having lunch, she's like, oh, I picked up these sirloins from Costco. Their whole life revolves around eating food. And so now they have a condo in Seminole, Florida, and she broke a tooth and she's like, I want the best. I'm like, okay, here you go. Send her over to Glen Pond. She goes, he's expensive, but he's good. I'm like, Mom, it's the best investment. Investing in dentistry is some of the best investments you can possibly make. We can prove that, Pat, that investments in your oral health improve the quality of life, the length of your life. So I think as a healthcare provider, I'm totally picking up what you're putting down. We have a job to do to help people, live better lives. There are people that fix teeth and there are people that change lives, and we got to just pick which side of the fence we're on.
And I think too, Kirk, we also need to have pictures of our cases,
yes.
To show people what you're doing. I would tell you in our consultation room, we have 5 different keynotes that are on we only do 4 or 5 different types of procedures. So it's important as a young dentist to build your library. I can't stress that enough. And when young dentists call me or when I lecture, I tell them, take pictures of all your stuff, document it, videos, everything, and put it into keynote presentations or PowerPoints and have them in your consultation room at the ready so that you can show them, hey, these are plastic teeth. Hey, this is zirconia. And by the way, these are all my cases, and if you're starting out and you don't have your case library, call me. I'll give you my slides. I don't care. Yeah. So I think it's important that you do that. You document your cases so that you can show your patients exactly what you're doing. And that way because visual is so important. It's so important.
Okay, go back to that because, I tell dentists this all the time. And they're like, I know, but like I've done one and it's crappy. I'm like, start crappy. Would you agree with this? Because the better you get at taking photos, it's going to put this natural pressure on you. It's like your first painting or whatever. You're going to be like, I can do better than that. I can do a little bit better. It's like a natural innate pressure you put on yourself, right?
100%. Just start taking pictures. Like even if they stink, who cares? Right. You got to start somewhere. So start taking start taking pictures. And if you want to take a photography class, gosh, you and I could refer people a million places. So I got serious about 13 years ago with photography. And a good friend of mine down in Scottsdale, I actually did his course, and it was the best things I ever did in my career. I had to take pictures in residency. We had no choice. We had to document our cases, and I think I was doing a pretty good job. But he took me to another level, and that to me has been the biggest part of my practice is my camera. I can't practice without my handpiece, my loops, and my camera. That's just kind of the three things. And now video is becoming even more important. Like we're taking video like we used to take photographs. So got to build your library.
How are you doing video? Do you have like a big expensive camera? Tell me what you're doing.
iPhone. These things can shoot 4K, so we just have an iPhone in the office. I'll whip out mine and I'll just be quick taking video on my iPhone. And it's on my SLR camera, but I find my iPhone to be much more convenient. So I just shoot the video with my iPhone. Yeah. Really, honestly.
That's awesome. All right, let's go a little bit deeper. What about teeth fracturing off? Okay, that's a big challenge for a lot of dentists. Where do I go with that? Give me a framework for that one.
Yeah, you better plan on it because, like you were just saying, I think Weil said it, everything's going to break. It's true. I was just having a conversation with a surgeon the other day who's new. He's kind of newer to town, and he's really jazzed up to do all-on-4, and he wants to treat all of his. He wants to train all of his referring dentists how to do all-on-4, and that's great. That's fine. And he said, yeah, I'm doing the conversions in my office, and I haven't had any problems yet. The teeth haven't broken. And he goes, so I don't know what everybody's talking about these failures. I said, I've been doing this now for 15 years, right? So just practice long enough and you'll see failures. And so you're going to have it. So on plastic teeth, if you do a traditional hybrid, let's say with plastic teeth on a titanium milled bar, the teeth are going to debond from the bar. It's just going to happen. And you got to tell the patients that, listen, it's going to happen. And when it happens, don't worry. Just call us. We'll get you in. We have people take pictures now when they fracture it, but it's going to happen. It doesn't happen all the time, but over time that is going to happen. Now, luckily, we have PMMA overlays, meaning that we're doing PMMA overlaying a bar. So the fracture rate's gone down, which is good, but you're still going to get stuff that's going to break, and you got to fix it. So you got to tell the patient, because a lot of times they're being like, well, this is my last dental bill I'll ever have in my life. And we're saying, no. You're going to have some dental bills. You're going to have maintenance, and you're going to have some fractures that we got to fix. And then zirconia, zirconia can break now too. So people are breaking zirconia frames, but we've moved almost exclusively to copy mills, Kirk. So meaning that there's a substructure with crowns on top of the substructure. And to us, that's been a winner, because if they break it, they just break a crown usually, and we can repair that relatively easy. So you got to tell them there's going to be some fractures. And the main thing is that you don't want the fracture ruining your weekend. So you just have to tell them, no big deal. You just call us. You take a picture with your iPhone where you fractured it. And then we do a same day repair with our technician. So meaning that if they have plastic teeth and they fractured it off the bar, they just give us a call. We set up a time in the office. They come in. we'll take a bite, we take the bar off, we give it to our technician, he'll fix it in the same day, and we'll have it back in the afternoon, and we put it right back on. We call it a same day service. So that's important to kind of dial that in with your laboratory.
Yeah, that is a great service. Now, we're talking about the edentulous dilemma, which dentists have in treating patients, but the patients also have a dilemma. And before we went live, you were telling me about a pivotal moment in your career, which you learned from Dr. Chris Ramsey, a dear friend of ours. Like, when you're talking to patients, you can't give them 30 options. And what Chris taught you was super helpful in helping patients make better decisions. Can you share that thought?
Yeah, I'm going to blow Chris up here, and he's not even going to realize it because I think he thought I was asleep during one of his presentations. So, one of the things that he talked about in his power persuasion lecture was the power of threes. And we've done that always, but I think when Chris was talking about it, it became even more powerful. And basically, on these cases, it's easy to get in the weeds, right? I mean, we can offer them 7, 8 different options. Patients get confused, and they're not going to case accept. And I'm guilty of this, by the way. So when I first got out of residency, I'm like, oh, I got to give people 8, 9, 10 treatment plans, et cetera, et cetera, et cetera. My case acceptance was lousy. So when I went to just 3 different options, I found that my case acceptance went up. And it's simply because, and I'm like this too, I can't think past the third one. If you give me 4 or 5, I just can't get there. So we give people just 3 options. And 3 options only to start off with. And so we list case good, better, and best. And it's amazing when you do that, how they can kind of get their arms around it. And so when we get to consultations, Kirk, you'll see we have option 1, option 2, option 3, and then there's a fee attached to option 1, 2, and 3. And we just do straight fees. We say, hey, option 1 is going to cost X, option 2 is going to be Y, and option 3 is going to be Z. And that's where then you got to have your photo library up there to be, hey, here's option 1. This is what it looks like. Here's option 2. That's what that looks like. Here's option 3. Boom, 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 boom. And then that way they can see and make a relatively, engaged decision on what they want to do. But we only give them in 3s. We only give 3 options.
Okay, so go back to that, because I'm gonna lead you with the question, because I love how you do it, and you're a brilliant mind in this. You don't laundry list each one of them, like each step and all the options underneath, like here's option 1, 2, 3 with all the itemized fees. Now, I'm saying this jokingly because I see a lot of great young dentists itemize fees, and you can see it goes all the way down the page. What have you learned in that perspective?
We don't do it simply, Kirk, because I'm a simple guy from the Midwest, right? I mean, people here just want the straight answer. Right. So I don't itemize it out because simply it's too confusing and people get overwhelmed. It's already overwhelming, right? I mean, we're talking about taking their teeth out and giving them prosthetics essentially. So this is an emotional thing already. If we start itemizing it out, I just found like we're getting too complicated and too much into the weeds. So we don't do that. But what we do is this. So once they choose which option they want to do, and this is, I left this out when we were talking earlier, but so let's say the option 2, whatever that is. And I say, okay, number 2, I then give them a Microsoft Excel document that says on the left-hand column, and I do this when I lecture. So people that have heard me lecture, bear with us. But on the left-hand column, it's how many appointments they're going to be. So appointment number 1, 2, 3, 4, 5, 6, 7, 8. And then in the middle column, it's going to say what I'm doing. And then on the right-hand column, it's going to be how long they're going to be sitting in my dental chair and when they can expect to be finished, right? Okay. So that's the number 1 question they ask about. How much is it going to cost and when are you going to be done? Kirk, what's the first question you ask your contractor when you're doing home remodel projects?
When is this going to be done?
When are you going to be out of my hair? Right? Oh, yeah. So that's what patients want to know in dentistry. They want to know when we're going to be finished. So I give them that Excel document with that. That does, first of all, it's impressive to a patient. They like it. But number 2 is that then when I'm on vacation, my staff, when a patient calls up, first of all, it eliminates the phone calls, right? So they don't have to call up and say, what's he going to do again? Blah, blah. If they do, it's in their chart and the staff can just pull it up and say, Mrs. Jones, next time he's going to do this, 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 and this, and you're going to be here for approximately about an hour and a half or an hour or whatever.
That's brilliant. That is awesome. That is awesome.
Oh, and Kirk, the more times you do this, you can already have those pre-printed, right?
Yeah.
So you can already have them ready to go, and you just have to change some of the pieces, but they should be ready to go.
Yeah. Now I get these questions all the time, and I'll just dish them to you. You have a fabulous practice. You've been free of insurances for, I mean, as long as I've known you. Like, you have a completely fee for service practice, correct? Like, you don't participate, or do you?
That's correct.
Okay.
Yeah, we don't.
If I'm a young dentist and I'm just flooded, Pat, I totally understand what you're saying, but I'm all PPO. Like, give me some perspective. Is this a profitable part of a practice in the future? And then how would I even begin to have a conversation like around insurance and all? Because I get these questions all the time. So I'm just going to throw them to you, and I know you don't play in the PPO environment, but help us out with just a little better thinking on that,
Yeah. So this is a hot topic that's coming up, and it has always been a hot topic ever since I've started practicing. And all I can say is that we spend an inordinate amount of time with these folks. So all the way from the preclinical interview to the records appointment, to the consultation, to the follow-up consultation. I mean, we spend a lot of time with these people, and I'm probably the worst salesman on the planet. So I can only do it so fast. And I don't know a lot of these people. They're coming to me brand new. So if I was in the insurance world, I don't know if I could do this that well, because it takes a long time to kind of go through that diagnostic and treatment planning process. So that's number one. And then, because I get this question quite a bit from a lot of dentists that I work with who refer cases to us, and they say, I'd love to do this case, but Pat, I'd be losing money on this case. And I turned to him, I said, I wouldn't do it if I were you either, because you're going to be upside down on this case, because it's just too much time. You don't have enough time in your day to do it, and you can't charge what you have to charge in order to make it, reasonable. And so that's the thing is, so people say, well, how do I break my PPO cycle? And I tell them, if you want to break the PPO cycle, you got to have the ability to solve problems. And you have got to be able to solve them as much as you can. And so not this treatment, but also you got to have the ability to take your time and diagnose cases correctly. And that doesn't mean you're drumming up dentistry. That's not what I'm talking about at all. But looking at tooth wear, looking at periodontal disease, looking at unrestorable teeth. If you want to comprehensively treatment plan patients and you want that type of practice, there's only the common denominator is time. You have got to have time to do it, and you got to want to do it too. So we get married to these folks, but you got to have the ability to solve problems, and you have to have the ability to solve complex problems.
Love it. I totally love it. And we're going to have you back for so many other things. I always just love chatting with you, and I love dishing the questions that I get that I can't answer. But I want you to, any last thoughts on this? And then also, you and I were hypothesizing about the future of even in-person education, but let's talk about edentulous patients. What does the future look like in dentistry? What could you see in the next couple of years in this area of dentistry?
I think it's going to get more and more. Well, you just said it earlier. People are living longer. They're essentially outliving their teeth. Let's be honest. I mean, our teeth were not meant to last as long as they are. I mean, which is great. I mean, we're living longer and we're having, quality of lives are longer, but we're outpacing our teeth. So I think this issue, which we're talking about, is only going to get more dramatic as time goes on. I really do. I don't see this slowing down at all. I think it actually is going to start to pick up steam. So I think that's where I see this going, is the ability to give patients this type of option is only going to be, it's got to be something you have in your practice. And if it's not, then you have got to be able to refer it out to somebody that can do it. But these patients are going to become more and more, they're going to start flooding your doors more and more. And some of these younger dentists are saying, well, I practice in suburban, wherever it is. I don't have these patients. And I just tell them it's a function of time, because they're going to have the young families that you're seeing are going to have what? Parents, grandparents, and those grandparents are going to need this care. So
For sure. Pat, this is awesome. Now, I'm just going to say this. If you're listening and you haven't had Pat speak, you got to have him speak to your club. I don't care if it's virtual or in person. He's an incredible educator. So Pat, your website is opdentaldesign.com. Is that, did I get that right?
You got it right, Kirk. Nice job.
Okay. So, and you love the speaking just like I do. It's with the study clubs, but give us some perspective on some of the topics you speak about when you go out and speak to clubs.
So I'm just a regular dentist, in the middle of the country. And so I go to small groups usually. I mean, yeah, the big podiums are cool and I get to show all my stuff and it's fun. But to be truthful, it's kind of not very rewarding. So I like going to smaller venues and some of these places and just really rolling my sleeves up and helping these dentists kind of improve their practices. And so that's kind of been my shtick for 14 years of, going on 15 years of lecturing, which is kind of nuts. But it's just been really just going and speaking to small study clubs or larger study clubs or wherever, and just helping dentists say, hey, listen, I have a practice that's just kind of like I've seen the same patients you're seeing. Tell me where the roadblocks are and I'll see if I can help you. And what I love about lecturing, Kirk, and you probably feel the same way too, is I get out just as much as I probably get more than I give, because, I can't tell you how many times I walked away from a speaking engagement thinking like, man, that's a really cool way to do it. We should do that. And I'll come home and I'll talk to my folks here and the specialists that I work with and be like, hey, let's do it this way. So that's been a lot of fun for me. So that, and then just all the incredible mentors. I mean, you have really done a great job with this whole thing as far as during the COVID conference and reaching out to all of us. And I mean, you hit the nail on the head. I would not be anywhere close without mentors. And I'm not a very bright guy, but I was smart enough to listen to people that came before me, and I latched on to them. And you were right. Go up and just ask them for help. I mean, they're always here to help you, and the really good ones are happy to help you. Yeah, I mean, they really truly are. And that's been the biggest thing. Because some people say, gosh, I don't want to approach that person. They're going to shoot me down. Not at all. We love it. So
they love it. And what's even better is not only are they great educators, but they're really fun people and they're good people. You know what I mean? So that's what makes this profession so incredibly noble, is it's just built with a lot of special people. And Pat, you're a big part of this. So
yeah, Kirk, I couldn't agree with you more. I mean, dentistry is about relationships. Really, at the end of the day, all teeth and diagnosis and treatment. But at the end of the day, the beauty of our profession is about relationships. I mean, I have breakfast every several weeks with a mutual friend of ours, Brandon James, and we just sit and we talk about dentistry. We talk about life and we talk about, and I just, I said to him one day, I was like, this is what it's all about, right? It's just having relationships and helping each other and talking through cases and talking through life and leaning on each other, because at the end of the day, when we're all dead and gone, the dentistry is going to not last, but our relationships do. And so it's a relationship profession. That's the good stuff, right? I mean, that is the fun stuff.
Amen, brother. You couldn't have said it any better than that. So thank you for being on, Pat. You guys have to check out his website, check out Pat's stuff. Pat, I'm just so grateful. And again, I want to have you back again and again, cover other topics in the future. So stick around while we say goodbye to everybody else. But thank you guys for listening to the Best Practice Show. And if you enjoyed today, which I know you did, do me a favor, hit that share button, share it with your friends. You're going to see also after the show we're finished with it, I'm going to give it to my writers. So anything we mention, you're going to see, just swipe up to the show notes. You're going to see all the links and the information that Pat shared on here. So you can check that out. I want to make this learning process as easy as possible for you guys. And until we see you next time, keep watching the Best Practices Show. You guys enjoy the rest of your day.